Scoliosis is a side bending deformity of the spine and also associated with the rotation deformity of the spine. That will actually produce a side curvature of the body, and also at the same time the body will actually twist it, produce a hump on the back of the body. The most common symptom of the scoliosis is they notice a hump on the back of the chest, and some of them notice a hump on the back of their loin. And usually this becomes more obvious when the patient bends forward, and you can see the hump become more obvious. And the other presentation is that they notice the shoulder is higher on one side and lower on the other side. That's because the shoulder tilt. And the third is that they notice the pelvic tilts. They're usually noticeable when they walk. One of the buttock is actually lifted higher than the other side. There are few causes of scoliosis. One of them is actually called congenital, and that usually because of the deformity or abnormal shape in the block of the spine. In the medical term, the block spine is called vertebra. So when there is an abnormal shape of the vertebra, when they stack together, they cause bending to the side and cause scoliosis. Usually congenital scoliosis start from birth. The second cause of scoliosis is actually neuromuscular cause. Usually there is an abnormality in the nerve or muscle tensions. So that actually causes the body to tilt to the less tension side. And the third cause is usually due to degenerative, which means there is a wear and tear in the spine. So there's a loss of support from one side of the spine, and that actually causes scoliosis. Usually this happens in the elderly patient between the 40 to 60 years old. And the last is actually the most common cause of scoliosis. They are actually called unknown, or actually the most commonly known as idiopathic, and it forms 95% of all the scoliosis. Number one, we don't know who are the patients, who are the people who develop scoliosis, so we can't prevent. But the recommendation is that we should actually detect it early, and once we found somebody has a scoliosis, we actually can prevent the scoliosis from getting worsened. That's by early detection and early treatment. Most of the patients come to me expect that their spine can be treated from curved to straight. But in general, in medical point of view, this is actually not really possible. However, in my personal experience, there are cases that come to me with a small curvature. There's a 10 to 20 degree of curvatures. When they have undergone treatment with the physiotherapy, the curvature do reduce in the number from the original presentation to lesser than what they have come to me. But for major cases that the deformity more than 30-40 degree, the treatment is just to prevent it from worsening. Two important factors will decide whether the scoliosis will get worsened or not. The first is the age of the patient. Number two is the degree of the deformity. The age of the patient is that if the patient comes to me at a very young age, then very likely that the scoliosis is going to get worsened. Usually these are the patients between the 10 to 16 years old, where the body is still growing and they haven't attained the skeletal system maturity. And the treatment for this group is that they need physiotherapy, and also they need the bracing. The second factor is the severity of the scoliosis. So if the scoliosis deformity is more than 45 degrees, very likely that this scoliosis is going to progress despite the kid has matured. And usually the treatment for this patient is a surgery. Okay, the most common self-test that the doctor recommends is we call Adam bending forward test. That is, we ask the patient to bend forward, and the second person observe from the back and at the lower level. So we can see the back of the spine is in normal people is actually equal, and then when there's a scoliosis, you can see one side of the body is higher than the other side. Not every scoliosis require surgical treatment. Normally, patients come to us at a very young age or at a small deformity. We encourage them to do exercise, or they go to physiotherapy, or they require brace treatment. But for patient with there's a high risk of progression, there's a patient with more than 45 degrees of curvature, or there's very anxiety kind of the deformities and causing some emotional psychological problem, or patient with the body tilted to the side, there's a loss of balance, then surgery treatment is required to treat them. So you have any of the symptoms like I mentioned earlier, there's a shoulder tilt, hump at the back of your chest, or you have the leg pelvic tilt when you walk, please do not hesitate to come to see us. The earlier we detect the scoliosis, the earlier we can prevent you from getting worse, and therefore prevent you from getting surgery.